Welcome to Lyme Time. I'm Allie from the Tick Chicks. We are all more than Lyme disease and chronic illness, and together we stand with you to overcome and rise. I'll bring you closer to the experts in cutting-edge treatments and even a few unexpected ways of healing. I'll ask the questions you want answers to regarding Lyme disease and successful ways of getting you closer to 100%. We are in this together and will not be defined by Lyme. Hi, everybody. Welcome to Lyme Time. Today, I have a very special guest, Dr. Jason Bachewich. I hope I got that right.
Yep.
And he is famously known on all sorts of social media as Lyme Doctor, as the Lyme Doctor. And I was really taken aback when I first heard him and started following him. And I think you'll be really on the same page with me because he addresses all things Lyme disease in a very succinct, palpable, authoritative voice. And he's coming at it from a very, very educated Lyme disease specialist point of view. He's a naturopathic doctor. And welcome, Dr. Jason.
Thank you. Thanks so much.
I'll leave it at Dr. Jason.
Yeah, that's good.
Okay, good. First of all, you know so much about Lyme disease and
Yeah.
tick-borne illness and chronic illness and mystery illness, and you consider yourself a Lyme disease specialist. So tell us, why on earth are you here talking about Lyme disease? What is your story? How did you come to be interested in this?
Yeah, actually, it's like most people that get into this world, they get into it because someone, either themselves or someone they loved, got sick. And for me, that happened a number of years ago when my wife she's a naturopathic doctor. She runs the clinic with me. All of a sudden, she's not able to get off the couch. All of a sudden, she's in a lot of pain. All of a sudden, she's having trouble holding thoughts and coming up with things that she should remember. And so, I started to panic because I'm like, you know what, this is something that we don't see a lot in our practice, this kind of rapid deterioration, especially in a young person. And we said, you know what? I started checking boxes off. I started sending her blood and urine and stool all over the world. And we ended up getting her a positive for Lyme, but also 2 bacterial co-infections and 2 reactivated viral infections. And then what surprised me was that when I went and I talked to some of my other colleagues and that nobody really had a clue about how to approach this. I go to the medical doctors, they're like, it's impossible, right? There's no way this could be it. And by the way, viruses like mono never come back. Like you get mono once, maybe twice, and that's it. It doesn't linger for decades. And anyway, so that's when I started kind of reaching out into the Lyme community and looking at other ILADS doctors. I started going into Europe, reaching out to the lab. I had ended up sending her blood off to Armin Labs, which is the one that gave me the positive response. And Dr. Armin was amazing at kind of going through the science with me. Immunology is not something that we have a strong kind of foundation in naturopathic medicine, and most medical doctors would say the same thing. And so that's kind of how I got here. It was just kind of through desperation. But I'm sure that's not a unique story for a lot of practitioners.
Sounds very familiar to me, and
Yeah.
it's interesting to hear from the other side. I also had Lyme plus 3 co-infections plus recurring sort of EBV, and my
Hmm.
doctor referred to it. She goes, it's just almost like a chronic EBV that will resurface a couple of times a year, and I could feel it, And so I feel like it's never alone. Lyme disease is never alone, but it's always there.
Yeah.
And I feel it as though that most people don't remember being bitten by a tick. I don't know if your wife, um, in reflection, does she have any idea when or how she got it?
Yeah, I mean, she did pull a tick off of her. It didn't have the bullseye, which we know only happens in about 10% of people. And then when we looked back upon her health history at that point, we had said, you know what, ever since she was in her teens, she can remember just not feeling as resilient, not as energetic, not as, able to stay up and do all the things that her friends were doing. And so we're pretty sure that she's had something since quite a young age because she lived in quite a rural environment. And then likely, she got this other tick, and it was that extra infection or 2 that she picked up that kind of tipped the cart over and ended up kind of causing a crash. Since, it's pretty rare to have 5 things kind of erupt in a very short period of time.
Sure.
So
Well,
I think that,
lucky she had you.
Well, yeah, I mean it was desperation, right? And I was lucky for the people that helped me. So that's what I'm trying to do with Lyme Doctor on Instagram and TikTok is I'm trying to give as much information to people as possible so that they don't give up because a lot of people are told you just that what they told my wife was, hey, you know what? You run a business, you've got kids, you're a doctor, you're stressed out. You're depressed. You're anxious. Here's some antidepressants. Go see a psychologist or a psychiatrist, and that's the answer that most people are getting, especially women. They get disproportionately kind of put into that bad category of you just can't handle life, and then they get dismissed. And so I think that's kind of what's motivating me right now is just to try and empower people to advocate for themselves as much as possible and give what resources are there for those people.
And about how long ago did your wife start having these symptoms, and about how long did it take for a proper diagnosis? And then how long after that? I'm assuming she's pretty healed at this point, or where is she in her journey? A lot of
Yeah,
people
yeah. So it was
want
it
to
was
gauge
probably
this.
yeah, it was probably about it's hard because the pandemic kind of throws off my timeline, but 7, 8 years ago, probably something along those lines, maybe a little bit longer. It was when the original kind of lab test that we had sent away, so maybe it even went further back. But nonetheless, that's kind of what happened. Now, my journey over those, it took about 2 years to get her back to where we were getting consistently negative results on the lab work. Now, what's interesting is through that process, we also tested her for mold toxins, heavy metals, hormones, gut microbiome testing, all of those things. And of course, when you have one system that is so disrupted, you find a bunch of other things. So we found mold toxicity, we found a whole bunch of other things. So it took about 2 solid years to kind of go through three what we call almost pulses. Because what we would do is we would do, intravenous therapies daily. We'd be doing pulsed antibiotics. We would be doing nutritional supplements, herbs, hyperthermia, like basically throwing the boat at it. And after about 17 to 21 days, she would be feeling remarkably better, to the point where the veins would start giving out and she was getting fatigued. And so we would say, okay, let's just take a break. She'd do well for 2 or 3 months and then she'd crash again. And we just kind of had this, and we had to do that 3 times. And eventually, after the third kind of burst of intensive treatment, we got it. Now, knowing what I know now, I think we could have cleared it up much faster, but I was learning at the same time as we were kind of working together. So it was one of those things, but it took about 2 years for, I would say, 90% recovery. And then the last 5 or 6 years for that last 10%. Because what I tell people is I say, even though you had the Lyme, it lives in your collagen, it lives in your brain tissue, it lives in your joints, it causes destruction. So if you kill the bacteria off, your joints, brain, and tissue is still destroyed. So that's all going to take time to heal. And so, you can't expect this miraculous like 3 month recovery unless it's quite an acute infection and you don't have a lot of conflating issues or co-infections or toxicities. So yeah, my realistic kind of rule of thumb is I say 1 month of intensive therapy for every year that you've been suffering. So if it's been 10 years, you got to do hardcore protocol for a good 10 months. Maybe you'll get better sooner, but quite often that's really what you have to commit to. And honestly, it's if it is autoimmune kind of involved, meaning you're starting to get arthritises, or you're starting to get chronic migraines or iritis or weird things where the body is kind of attacking itself, that's going to even take longer because removal of the bug does not stop the immune system from attacking itself. Now, the other side of this too is I know it's something that you and I had talked about a little earlier before we got on the podcast, which was this integration of the DNA with the Lyme disease. And there seems to be some evidence there that because the Lyme bug bacteria lives within your tissues and potentially within your cells, that there can be exchange of genetic material. And so over time, and this is kind of what, when you go along this theory of evolution, if you believe in that, or in like even the involvement of parasites, like how bacteria become antibiotic resistant, et cetera, some of that is potentially gotten from its coexistence with other bacteria that it'll pick up other information from. And then there's this idea that phages are involved. So like potentially viral mediators of this viral DNA kind of migration happening, because viruses kind of snip pieces of DNA and they can kind of transmigrate it into other bacteria as well. And so there's a lot of theories around why this happens, but quite often this is what we see with people that have had chronic Lyme disease that have this autoimmune tendency. And then the question is does it ever go away, right? Why does it always come back? Why do I always feel like I have it coming back? And it might not be back. It might just be the body continuing to attack itself. And then if that's the case, that's a whole different strategy.
Wow. But I just want to go back to the mold toxicity that you speak about with that
Yeah.
your wife had. And I'm assuming you did not have it in your own blood work, or your own testing. What did you attribute that to? Did you have to get her out of a moldy environment, or was she just carrying mold toxicity in her system?
Yeah, that's a great question. So the minute we saw it and it was gliotoxin, which was the really bad one, the black mold, of course. There was ochre toxins and stuff too. And so all of a sudden I panicked. I go, okay, oh my God, our house is destroyed. We're gonna have to move. So I had the house tested, it was clean. I had my kids tested and myself tested. We were all clean. So we knew that that mold toxicity had predated our existence together, which in this case,
Wow.
we've been together a long time. At that point, I think it was around probably almost 30 years late, 25 to 30 years we had been together prior to that point. So this predated that. So she was still carrying that around since childhood. Like, who knows, that may have been why she was always fatigued as a kid, maybe why she was hampered with chronic mono and all this thing over the years. So yeah, it's pretty amazing that you can have those kind of um, things linger for that long. On a personal note, I'll probably share too much here, but for myself, I worked in the agriculture industry and I was exposed to a number of treated seeds and chemicals when I was bagging seeds as a teenager. That stuff's still coming out of me now, 30 years later. Living as good a life as I can, and it's still dumping out in the urine. So you'd be surprised at how long your body can hold on to these toxins for, especially during an acute exposure like that, or even a chronic exposure. And part of that just comes down to genetics, right? They always say, well, why is that? Like, why didn't my brother or why didn't my sister get sick? And we say, well, why can I drink a cup of coffee before bed and sleep fine, and my wife can't drink it after 10 a.m. or else she has a horrible night's sleep, right? Like, there's just genetic differences in detox capabilities, and so that may be what the why, because I always get the why. Well, that can't be, because everybody else in my family's healthy, and you go, well, yeah, but maybe you just really suck at detoxifying.
That would be me.
Yeah.
So let's say a typical patient comes in and they might have, let's say they have a viral thing that's recurring. They
Mhm.
have some tick-borne illness and they have some mold toxicity in their labs. What would you recommend attacking first?
Yeah, that's a good question. Usually I attack the one that has the greatest chance of creating long-term irreversible damage. So in this case, from what you had said, we would say if Lyme disease came back positive, we would attack that first. That would be the main thing. Now, again, I would say all of this is fluid because if somebody is full of mold toxins and then they take antibiotics, there's a good chance they could react poorly to the antibiotics because they're already like antibiotics are by definition mostly mold toxins. So if you're full of mold already and then you add in mold toxins to try and kill the bacteria, you could actually make yourself significantly worse. And that is often kind of confused with a Herx reaction. So this is where like really dealing with a Lyme literate doctor that has a lot of experience in terms of teasing apart what is truly a Herx and what is a mold toxicity reaction. I mean, it's really, really important. And honestly, like, do I get it right all the time? No, for sure. In a perfect world, what I would do is I would probably make sure their digestion is optimal because that's how you detox everything from pharmaceuticals to mold toxins. We have to make sure that that gut is working properly, and we have to make sure that that person is I guess probably how I describe it, living as in a healing environment as they possibly can, right? So this is where they're not still going to the gym 5 days a week. They're still not, going to every parent teacher meeting in the evening times, like actually saying, I'm sick and gearing down and saying, I'm getting prepared to fight a battle, right? When people are, preparing for a large performance, they don't often run themselves ragged right before. They often take a bit of a break before that performance on stage or whatever they're doing. And so, it's really important to set the foundation for that, assess that. If that's all good and they're ready to do this, then hey, we can jump in with both feet forward. We can address the mold and the Lyme disease at the same time. Viruses is a whole nother ball of wax. So viruses are, some of them never go away, right? Like Epstein-Barr virus, you just suppress and put in a box. And so you can do intravenous vitamin C, artesunate, glyceric acid, like from licorice root. Those things will quickly put it back in a box in a matter of a couple of weeks if you go intensely at it. But that's just a band-aid. It's really fixing all of the other things that are going on first. So I often leave the viruses for last. Sometimes leave the mold because we say if it's been there for 20, 30 years, well, what's the chance that, a couple months is going to make a difference? And start with the things where there's actually cellular destruction and real kind of negative progression. If the person is just kind of what we call stable, so bad, good, bad, good, bad, good, but not like ending, going towards being in a wheelchair, then at that point we can go after the mold first or the bacteria first. It really depends where the symptoms are most on fire, I guess you'd call it.
Mm-hmm. Interesting. I'm here with Dr. Jason Bachewich, and
Got it.
I think I got it. And we're discussing all things pretty much Lyme. And I was recently, I went to the ILADS convention. I think you did too. And you spoke there. Yeah. And, you have a great voice in the community. And I get a lot of calls and questions from people that are in Canadians that are looking and searching for Lyme literate doctors. So it's just an honor to have you here. So let's talk about specifics. When you get a Lyme disease test back, and let's say you have what I call true Lyme disease, which is the Borrelia bacteria, and then you might have some co-infections.
Yes.
Can all Lyme and co-infections be eradicated?
My opinion on that is,
because I've heard conflicting. I've heard that the Lyme, the Borrelia it can be put into suppressed and put into remission for a while, but it'll always stay with you or possibly in your blood work, and that the co-infections are a little bit easier to eradicate. But I want to know, what's your opinion on that?
Yeah, from my personal experiences, if you don't take your foot off the gas too quickly and you stay committed to a long-term protocol where you're actually looking after yourself, I've seen blood work come back clean for years and years and years, meaning no antibodies, no Th1 response, no nothing for years. And we're talking about people that lost a spouse. We're talking about people that got in car accidents, like major stresses in life that would have normally elicited a response, and their blood work is coming back normal. So I think bacterial infections, in my opinion, you can get rid of as long as you stay on top of them. The problem is that most people, either for financial reasons or just pill fatigue or whatever it is, they give up or they stop taking it as soon as they feel good. I always tell people, like when you have a sinus infection and you take antibiotics, for example, usually after 3 or 4 days, you're feeling better, but the doctor always says, take it for 10 days. Right. And that's where I find that most people drop off, and then they're coming back to see me in 8 months or a year later, and they say, oh, I'm feeling crap again. I'm like, yeah, it's because you disappeared. You stopped doing what you were supposed to be doing. And quite often it's the way that the people are living that leave themselves prone to that too, right? So lack of sleep, high stress, eating crappy, all of those things, right? So I have people in my family that are living examples of this that have had cancer multiple times. We get them better. They get the all clear on the cancer. And a couple of years later, another cancer comes out. But that's because he went back to eating beer and wings and drinking a bottle of vodka every Friday night. You know what I mean? Like, the lessons have to be learned. Like, I do believe that it's one of those things where you say, okay, this is a sign from God. This is a sign from the universe. This is a sign whatever, that you have to live differently. Yeah. And I think that's the hardest thing for people to do. I have a hard time with it too. But anyways, long story short is, yes, I spoke too long there. But bacteria, I think we can get rid of. Obviously, the viruses we don't. But I've seen it. I have proof of that it's gone. But it's one of those things that you just have to follow people long enough. And honestly, I have people that have money that come and see me, and I say every 6 months we're testing for the next 10 years. And sure enough, it's always coming back clean.
That's amazing. And
Yeah.
that is going to give a lot of people a lot of hope out there. And I agree. I mean, it's one thing to be taking all the things and doing all the things and trying to detox and all that, but then there's a birthday party or there's a vacation or there's something, that comes up, the pandemic or whatever, where we all revert back to poor lifestyle change, poor lifestyle, you know, tendencies, and that gets the best of us. And before we know it, we're back on our butts again.
Yeah.
Um, have you ever had somebody, and I'm sure you have, that comes in and says, "Doctor, I'm doing everything right. I am eating clean. I am taking my herbs. I have dedicated years to overcoming Lyme disease,
Yeah.
and I'm just not getting better."
Yeah.
Where do you start with them?
Yeah, good question. Well, I mean, obviously, I go through all the lab work and make sure that they truly have been, one, tested properly, but also two, every avenue has been looked at, right? To rule out any kind of physical reason why that person may be impaired from getting better. And this even involves looking at genetic testing. So, for example, even in my own family, there are people that have what they call a delayed Th1 response, or a delayed Th2 response. And so this is a genetic tendency as to why, when you have a family of four, why someone will get sick and better within 2 days, and then the other person, 10 days later, they get sick from the same virus and they get hammered for 5 days. And that's because they have this delayed Th1 response that allows the infection to kind of set up shop before the immune system comes around and attacks. So, even just looking at the latest in terms of genetic information as to why the body may not be able to kick out this infection, or why you're susceptible to it in the first place. But I think that's a big part of it is really looking for gaps in the treatment protocols. And quite often there are gaps, right? Quite often there are things that are not looked at, right? For example, like microbiome testing, and saying, okay, like, is it not only having parasites in the gut, but it's also, do you have the right gut bacteria in the gut? One of the tricks that I often do with patients, or I don't want to say tricks, but one of the things that I do that doesn't cost a lot of money is often I'll get them to fast and just not eat any food for 3 to 5 days and say, okay, if you fast and you feel worse, then quite often and again, don't do this without under supervision, because some people are quite sick and they could fall down the stairs because they're lightheaded. But anyways, do this under supervision and with people watching you. But you don't eat anything for 3 to 5 days. Well, what happens is your body starts catabolizing itself. It'll start dumping stuff out of the tissue. So if you have infection there, it'll dump it out. If you have toxicity there, it'll dump it out, and you'll feel dramatically worse. When people have an autoimmune tendency, meaning they don't have a lot of toxicity issues, they don't have a lot of infections, um, when they fast, that's actually the body's time to go out and basically heal and create, heal scar tissue, decrease inflammation, etc. It uses all of its resources to go out and heal and to fix problems. And so quite often, if people feel better when they are fasting, that can be more of an indication that this is an autoimmune tendency, meaning that it's related to your gut, it's related to your microbiome, it's related to your hormones, kind of what's happening inside of you versus something being inside of you that shouldn't be there. So it can be a little bit of a quick and dirty test, but it's not, it's not foolproof, but it's one of those things that we can kind of just say, hey, why don't you just try this out? Do you feel better or worse? And if you do, then that's kind of the area that we're going to focus on. And we'd be surprised too. Like I've even had patients that I've tested for, all of the infections known that we can test for, and they're still sick. And I say, you know what? Okay, I'm going to check off even more boxes on some obscure lab. And sure enough, I found some weird, like, parrot fecal parasite in this one patient. And I'm like, what? Like, how do you get a parrot parasite in your gut? And why would you even test for that? Right. But who knows, right? Like, you went on a trip to San Diego and some bird crapped on a railing and you had a bunch of fries after you touch the railing, right? Like, so we just always keep looking. There's always a reason. I always say to patients, when you cut your finger, do you ever worry that it's going to heal, right? Maybe if you're diabetic, you do, but everybody else just goes, no, if I keep it clean and dry, it'll heal. So there's no difference with the inside of your body and your brain too. If you keep picking that scab, it won't heal, right? So obviously something's picking at you in the inside or shouldn't be there. There's got to be a reason.
Amazing. So let's talk a little. You're in Canada, I'm in California, and I've talked to some other really great doctors that practice in Mexico.
Hmm.
And then I hear about celebrities going to Germany and Switzerland and doing all kinds of things. Lyme disease is global, and we hear about restrictions here in the United States, or what we can and can't do here. Why would somebody go outside the United States to get treatment, A? And B, what are some of the differences in treatments in other countries? I mean, should we be looking outside our own country for proper treatment?
Yeah, that's a good question. I often tell patients that there isn't a lot that they do outside of the country that we can't do here. The difference with it is that quite often it's more intensive in a shorter period of time, and it's done in a more healing environment, right? When I have a patient driving a half hour through traffic every day to come for an IV, they arrive stressed. The process is stressful, et cetera. So I say, you know what, if you can afford it, go sit under a palm tree, have someone make you a fruit smoothie and get your IV dripping, watching the ocean. I mean, that is a healing environment, right? So if you can afford it, so there's the mental, emotional, kind of spiritual aspect of kind of going away with the pure intention of healing yourself. There is power in that. Most people can't afford it. And so in terms of, doing antibiotics, doing hyperbaric, doing, IV antibiotics, doing all kinds of interesting, insulin potentiation therapies, all of those kinds of things, those are all possible to be done in the US. But there's just this, I liken it almost to the Mayo Clinic. Quite often, the Mayo Clinic doesn't do anything magical. They just do it all in a shorter period of time. And so that's kind of what a lot of these labs out of the country are doing is they're doing a lot of treatment in a much shorter period of time and in a more healing environment. And so I think you can get a lot faster somewhere or a lot quicker somewhere. Not to tell patients not to see me, but I want them to get better ultimately. So if it's an option, I encourage them to. Now, there are some techniques that, like plasmapheresis. I don't know how popular that is in the States. It's kind of like taking the blood and filtering it, and kind of filtering all the bacteria out of the blood, almost like dialysis. That's kind of something that they're using a lot in Germany. Hyperthermia under general anesthetic with IV antibiotics at the same time. That's also a trickier thing to get done in the United States, and it's not even possible in Canada. Where they put you completely under, they cook you about 41 degrees Celsius or whatever that is, 120 degrees Fahrenheit or
It's
150.
hot.
It's hot. And then they drip those antibiotics in at the same time. So you're kind of like cooking the bacteria and throwing weapons at it at the same time. So, for something like that, yeah, I feel like it's just better to go somewhere where they do it all. But again, there's a cost issue there.
Yeah. Yeah. And there are places to get it done in the United States. I know that
Yep.
for sure. And, some of the less common things, even just a few years ago, like ozone and
Yeah.
10 pass ozone and things like that, it wasn't common. Nobody knew what it was. It was one of those weird things. And you still have to seek it out a little bit in the United States, some of
Yeah.
these treatments, but you can find it. But I agree, a lot of the clinics outside the United States will want you to come for at least 6 weeks.
Yeah.
6 to 8 weeks. And I do think that that's probably a very unique and special way to heal,
Yeah.
rather than fighting traffic and trying to get to and from treatments, once a week.
Exactly.
So I want to talk to you a little bit about how you practice, and are you still doing, personal practice? How would somebody get in touch with you? And then I want to also talk about what protocols you offer and what you're working on.
Yeah, sure. So, I mean, I I practice out of Winnipeg, Manitoba, Canada. The clinic I work out of is the Nature Doctors. So the website's thenaturedoctors.ca. My Instagram and TikTok handles at Lyme Doctor. So it's nice and easy to remember. And I am still seeing patients. Actually, I just sold my clinic and I'm just focusing on seeing patients individually so that I have more time and energy to do the patient work and less time managing other people. So it's been relatively recent that that has happened. So I am, for the most part, kind of fully engaged in this now and ready to step up my efforts in terms of helping people. Um, I guess the other thing is kind of like how is my approach? So it's interesting, like in Canada, in the province that I live in, we don't have prescribing rights, which means that I have to work with medical doctors or nurse practitioners, of which we do have one in our clinic. So she will do the prescribing. Or in Canada, it's interesting because we have a public healthcare system, right? So um, there's resistance to innovation, there's resistance to new therapies. And so in Winnipeg here, I was helping start Canada's first publicly funded Lyme disease clinic. So we have that now. It's horribly underfunded and understaffed, but there is a wonderful doctor, Dr. Goulet, who's spent a lot of hard-earned energy and put his reputation on the line to become a medical doctor in Canada that believes in the possibility of long-term Lyme and some of these other things. So we do work often with the ticks clinic, as it's called, the TICCS clinic, which is the government clinic, and Dr. Goulet. And for the most part, like I said, between the nurse practitioner and myself, we will do what we call like a hybrid approach. So for most people, they'll say, can I just get better on herbs? Can I just get better doing antibiotics? And quite often, like I said, I think depending on how complicated your case is, right? Do you have heavy metals? Do you have hormone issues? Do you have, like, if you have got a lot of stuff like that, you're going to have to do more than just taking cat's claw and knotweed, right? You're also going to have to do more than just taking amoxicillin and doxycycline. So I find that a hybrid approach is generally the best approach. So we'll do antibiotics, usually a pulse dose therapy where we're switching between extracellular, extracellular, intracellular, and cyst busting medications, and then giving the body about a week off after every pulse just to kind of rejuvenate and repopulate the microbiome. So we're doing these hybrid protocols with IVs, with pulsed antibiotics, with herbs and supplements, with physical therapies like hyperthermia. It just depends how much people can afford and how much they are committed to doing the treatment.
And do you do that protocol no matter where they are in their Lyme disease journey, or would that be more if they're in an acute stage, you're going to do the pulsing? Or if somebody comes in and says, "Hey, man, I think I've had this for like 5 years and I hadn't had my answers," would the approach be the same?
Yeah, normally it isn't the same. I find that the pulse dosing typically works better for chronic. Um, I don't usually utilize it for the acute stage, partially because the acute stage we'll see, if you did a pulse dose in the acute stage, then the bacteria has more time to become resistant to the medication. Once you're in the chronic stage, it's already resistant to a lot of things. It's well set in, and so we need to, as we're pulsing certain medications, we're also kind of pulsing natural medications at the same time, so that we're, no matter what, we're always affecting some sort of mechanism to which the bug is being attacked, but from a unique and novel situation, so that hopefully it resists the urge to kind of go into that cyst or hibernating stage, and then we can keep kind of lopping the heads off as time goes on. So the chronic, I typically have had more success using a pulse dose over a longer period of time, but that specifics of that pulse dose do change depending on that patient itself. So, if they have a lot of resilience in them, meaning they are able to handle a lot of stress, we'll go at it much harder. If they're really febrile, they don't have a lot of energy, they are beat down and cooked, then we're going to go much more gentle, right? We have to try and build them up more than cut them down at that point. So I wish I could be more specific about that, but that's kind of my approach. In the acute phase, we can just throw everything at them and just go for it just to prevent it from getting settled.
Are you able to see patients virtually?
I am, yeah, yeah,
And they have
yeah.
to be within Canada, I'm assuming.
I mean, technically, they have to be within my province as well. Now, I can do consulting, I just can't do treatment. So that is something that I have done where I've said, okay, like throw me your file. Let's have a look through everything. These are the gaps. This is what you're going to want to ask this doctor for. I know this doctor is great in your community. Go to them,
That's
tell them.
phenomenal. That's
So
helps so
yeah,
much.
kind of doing just an overall assessment and kind of gauge of where you're at and saying this is the direction you need to go, and then helping you to find someone locally, hopefully that can help you or close by.
So, in closing, I just, first of all, I want to say I could talk to you for hours and maybe you'll come back and we'll talk about new and exciting things in the Lyme disease community.
Yeah.
But just here today, in closing, are there any final thoughts that you would have to our listeners out there who are really in pain, really confused, maybe gaslit by the community, and just, what can you offer to them?
Yeah. Oh man, that's a good question. I think always just remembering to trust yourself. After a period of time, you will honestly think that you're going insane. You will start to believe that potentially all the things that people are saying to you are true, and that's just a natural kind of psychological state that'll happen. But just know in your heart that if you know something's wrong with you, you keep pursuing that answer until you get that answer, and just not giving up. I think that's what's important. And I think just gathering more and more information. There is no silver bullet out there, right? I could say, oh, take nanomycel silver or do methylene blue or all the other things you and I haven't talked about today. But the point is that I think people forget that they're individuals, and so therefore their healing journey is very individual as well. You can't just do this kind of standard protocol and expect the same outcome, because if it was like that, cancer would have been cured, right? Like, so we really need to look at things like what makes you individual, what are all the pressures on you, and like I said, trust your gut and keep going for it. And you're going to have friends and family thinking you're crazy, and this is one of the hardest diseases to have, because you're literally a walking wounded person, but you're invisible because you don't look sick, and yet you feel terrible. And so you have to stay really strong within yourself, and counseling or having a good social network or some sort of support network, that's going to be key to you being successful. So I think that's my message is just not to give up and stay true to yourself, and just be firm in knowing that you know what's best for you.
Thank you so much. Love
Yeah.
that. Talking about intuition and just staying true to yourself. And tell us again where we can get in touch with you.
Yeah,
That's
you can book through the website at thenaturedoctors.ca, or like I said, through Instagram and TikTok. I'm just taking a little bit of a holiday over the Christmas here, but I'll start posting content again very soon. And then like I was talking a little bit earlier, I'm going to be developing a protocol with some products and some pulse dosing stuff, and that we're going to be able to offer hopefully through a website sometime in the springtime. And because my last name is just terribly long in Ukrainian, which is Bachewich, I'm going to call it the BACH protocol. So keep your eyes open for that. And I'm hoping that it'll be kind of a low cost, well-educated protocol that people can use as foundational stuff as they're searching for their answers.
I love that. And hopefully it will be available to us in the States as well.
It will be 100%. I'm going to be launching it in the States first.
Okay, good. Amazing. We'll
Yeah.
be ready for you. So
Okay, perfect.
anyway, thank you so much for your time, Dr. Jason. I really, really, I just learned so much through this
Thanks.
conversation, and we hope to see you soon.
Yeah, thank you. I appreciate it.
Thank you for listening to this episode of the Lyme Time Podcast. If you like what you heard, please subscribe on your favorite platform to be notified of new episodes. Remember, this is not intended to be medical advice. Take your findings to your provider to see if something is right for you. No two bodies heal the same, and your doctor knows you and your labs best. You can find out more about the Tick Chicks at thetickchicks.com, and if you subscribe there, you'll be notified of upcoming events like the in-person Losing Lyme retreat that I host. I also have shopping pages dedicated to helping your at-home symptom relief, as well as a private support group. Join the Tick Chicks tribe on Instagram, YouTube, Meta, TikTok, Pinterest, and X. You are not alone.